Give the call to the member for Swan.
Thank you, Mr Speaker. My question is to the Prime Minister. How is the Albanese Labor government delivering on cost of living relief and making healthcare more accessible and affordable after a decade of cuts and neglect?
Give the call to the Prime Minister.
I thank the member for Swan for her question and for hosting me regularly in her wonderful seat in Perth, because she knows that making healthcare more affordable is one of the key elements of this government's plan. Making it more accessible is part of our plan for a better future, and that's why we've rolled out 58 urgent care clinics right around the country. That's why there'll be more included in our budget coming up in May. That's why the centrepiece of our last budget was tripling our investment in bulk billing, the largest ever increase in support for the Medicare system since Medicare was introduced. But the other element, of course, which the Health Minister has presided over, is the important reform of making medicines cheaper. First, we had the policy that we announced during the election campaign of a reduction from $42.50 down to $30 that came in on January 1. Now, since then, that has resulted in savings of around about $300 million. But there's more, Mr Speaker, because our historic 60-day prescription policy has already saved Australians $12 million between September and January alone. Most importantly as well, it means less trips to the doctor. It means less trips to the pharmacy. It means that people can get the care that they need for those regular prescriptions that they need, be it for diabetes or heart conditions, so that they can have that certainty of the availability of 60-day prescriptions. And importantly, there is now broad support for 60-day prescriptions, including from community pharmacies. The only people who are still opposing 60-day prescriptions are those opposite, who say we want people to go to the doctor twice as often, we want them to pay twice as much, and we want them to be so inconvenienced. Now, we're supporting as well pharmacists to deliver more primary care services, something spoken about by those opposite but never delivered. What this is about is making sure that it's easier for Australians to get the care they need when they need it. Taking action on cost of living on health care, together with our tax cuts that come in on July 1 for every taxpayer, together with cheaper childcare, together with the 300,000 fee-free TAFE places that commenced last year, together with our energy price relief plan that has had a positive impact. All of them opposed by those opposite. An opposition bereft of any ideas or any